Hi, my name is Paul Schwartz. I'm the Director of Neurosurgical Oncology and Skull-Based Surgery at the Air Neuroscience Institute of Hartford Healthcare and Hartford Hospital. I've always been interested in how the brain worked, how we think what we think, and why we think what we think. And I developed an interest that led to graduate school and then medical school for sort of trying to figure out how to help people make their brains better. So I have a PhD from Johns Hopkins University in neuroscience. I got that PhD before I actually went to medical school, and it focused my interest in the neurological sciences and especially in neurosurgery. When I do tumors, malignant tumors of the brain and spine, those folks usually need a surgery sort of more urgently than the skull-based patients that I do. In general, we operate when we need to, not when we can. Essentially, there are people out there with tumors that I can take care of that would rather not have a surgery, and there's no reason for them to have a surgery. So we work with the patient individually to figure out if I can benefit them from what I do, because surgery is, after all, quite an invasive process. So one of the major things that I do that few other people do is the endonasal, transnasal approach to the anterior skull base. We take out very large tumors through the nose with no cranial incisions. And so if we go through the nose, we have a really nice corridor that doesn't have a lot of neurovascular structures in the way that we can damage. For the most part, people with these tumors will spend a few days in the hospital to make sure that they don't develop any of the potential complications, but then they go home, and most people do quite well. Referring providers and patients should know that we have one of the busiest skull-based practices in the entire Northeast here at Hartford Healthcare. We do a very large number of tumors of the skull base, including pituitary tumors and skull-based meningiomas and skull-based acoustic neuromas and the like. And again, our practice is very busy and our outcomes are very good. Outside of medicine, I'm an avid cook, and I've put together dinner parties routinely for more than 100 people. I cook Thanksgiving dinner every year, from soup to pies to nuts, and I really do like to entertain my family and friends and putter around my yard an awful lot.